Hello, my name is Dr. Hillel Mazansky, and I specialize in medical hypnotherapy, guided visualization, nutrition, and exercise. My website being drmedicalhypnosis.com, upon which you will find many videos and hypnosis videos to suit your physical or psychological ailments. Before I begin with today's health tip, I'd like to make two short announcements. Firstly, I would like to welcome all my new members of Pinterest who has joined me in health and happiness, and it has really been stunning to see how many did join with me. And I recommend all of you to join Pinterest. It's one of the nicest, easygoing social media websites that there are available. The second is a little more ominous. On Tuesday, the CDC made an announcement that there was a 400% increase of overdoses that report to the emergency room for using strong narcotics such as Percodan, oxycodone, morphine, etc. This is not a good sign, and it must be treated immediately. The fact is not only the patient going from doctor to doctor, or as we call doctor shopping, to get the narcotics, but the doctors themselves are writing more and more prescriptions leading to abuse. Why then, we might ask ourselves, is it mainly in the females? Because it is the females who suffer chronic pain conditions such as chronic neck and back pain with or without surgery, migraine headaches, fibromyalgia, irritable bowel syndrome, and more. All these videos are available for you to empower yourself to help treat yourself. Medical hypnosis and my videos are non-toxic and they have no side effects. Encourage any of your friends who you are seeing as getting involved with drug abuse to go to my website and learn and get those applicable videos that are germane to them. It is also that doctors do not see men patients, as men have bravado. They don't go to the doctor that easily, and they diagnose themselves with something different. So that is the second announcement I have to make, and it should be taken seriously. Okay, on to today's health tip, which is entitled Surprising Facts About Coffee. Coffee was first developed in Ethiopia, and then Colombia started manufacturing their coffee. That's where most of the coffee comes from. Now, coffee can be either decaffeinated or caffeinated. Find out from your supplier if the decaf coffee is water washed and not chemical washed. Because if it's chemical washed, those chemicals adhere to the coffee or the coffee bean and can be toxic to your health. If they say it's water washed, then fine. There are medical conditions that respond to coffee, which was previously years ago maligned in as much as they say it rose your blood pressure. Evidence now shows it decreases blood pressure and it's toxic, etc. We are now using coffee to a great deal. Cancer patients should be given coffee decaf or regular. The amount of coffee that the average American drinks is 3 to 4 cups a day, which is enough to fill a small tub bath at the end of the year. Gallstones. Gallstones reduce the size and occurrence thereof if you drink coffee. Now, you might ask, why is coffee anti-cancer? Because it has many polyphenols and antioxidants, which are benefit for your health. So cancer patients should drink about 4 cups. There was one study done last year that showed that if a patient has metastatic cancer of any type, they should drink up to 10 cups of coffee a day. Obviously, at this high rate of coffee ingestion, it should be decaffeinated, because complications from too much coffee can lead to ulcers and bleeding conditions, etc. In a study that was done 2 years ago in Sweden, they found that a woman's stroke risk is reduced by 23% by drinking 4 or 5 cups a day. Heart rhythm problems are also controlled by drinking coffee. One would say, well, if there's caffeine, it'll affect the heart rhythm. That is just not true. The higher the consumption of coffee, it treats Parkinson's disease and it lessens the tremor. This doesn't happen overnight, but it takes a while for it to happen. Drinking coffee has a lower risk of developing Alzheimer's disease. Type 2 diabetes is affected in a positive way by drinking at least 4 cups a day. Females who drank at least 4 cups of coffee a day found a reduction in their depressive symptoms. If a female is pregnant, they should not drink more than 12 ounces. Long-term studies have proven that coffee does not raise your blood pressure. Years ago, we all thought it did, but here the study proves conclusively that it does not raise your blood pressure. Type 2 diabetes is affected in a positive way. Now, the following should not drink coffee: if they have a history of allergy to the coffee, and people suffering from GERD, which is gastroesophageal reflux disease, or chronic heartburn, peptic ulcers, should not have it. If you drink, again, I must mention, if you drink decaffeinated coffee, ask the supplier to make sure it's water washed. You don't want it to be chemically washed, because those chemicals will cause further symptoms. So this, I think, is a good overhaul for you on the health benefits of coffee. So next time we all meet, we will have a cup of joe together. My name is Dr. Hillel Mazansky, and I thank you for listening to this health tip.